On today's episode, we shine a light on a vital yet often overlooked form of caregiving, kinship care. This is when children are raised by relatives or close family friends, rather than by their parents or through foster care. I'm joined by Dr. Pila Terry, Executive Director of Seattle's Atlantic Street Center, to explore the challenges these families face and the support that makes all the difference. From grandparents stepping up in times of crisis to extended family offering stability and connection, kinship caregivers play a powerful role in shaping young lives. Here's my interview with Dr. Pila Terry. Dr. Terry, thanks for coming.
Oh, yeah. Thank you.
Is it okay if I call you Pila?
It is. Please do. Please do.
I'm really excited to hear about the work that you do at Atlantic Street Center. And so I would love to actually hear you tell us about Atlantic Street Center and particularly about your program for kinship caregivers.
Oh, well, first of all, let me thank you for having me here. It's an honor. And I should tell you that Atlantic Street Center is celebrating 115 years.
Oh, my goodness.
This year, yes.
Wow.
Yeah, in February, we celebrated that, and we're having a big milestone celebration this fall. The organization has grown. I mean, we started off working with Italian immigrants and working with them with youth and mostly teens. That evolved into what is now one of our biggest divisions, which is our youth development. We do educational support, but we have three other divisions. One is behavioral health. We're a big behavioral health care provider in the youth space, and we do family supports with that as well. We also are in the early learning space for 21 years now, part of Parent Child Plus, that national model. And for the last 8 years, going on 8 years, we entered the domestic violence and gender-based violence space. So we do work with survivors, we do advocacy, a lot of bilingual support, rehousing, homeless prevention, and clinical services there. So it's pretty robust now, very much wraparound, so we start with the children and wrap around families. Yeah.
And then, but now you work with grandparents.
We do. We do.
What was the need there for working with grandparents? What were you hearing from your families?
Mostly that children were no longer in the custody of, say, their mother and father, their actual parents, for a variety of reasons. I mean, some needing help, supports, medical and otherwise, and that more and more it's the grandparents, the great aunts, the great uncles that were stepping in and becoming that caregiver for children. So we, over the years, became much more responsive, formalized services. We partnered with others here in King County, and actually we launched it in King County. Kinship Care is what we provide, and work collaboratively with the King County Collaborative on that, and some other organizations. And we pretty much, it's robust, but it's underfunded, unfortunately.
So what I saw from looking at some of the statistics about kinship care is that kinship caregivers are tending to get to be older and older. So average age being about 60 years old or so. That's pretty challenging when you're suddenly finding yourself caring for like a 5-year-old in today's environment, right?
Exactly, that is correct. At Atlantic Street Center, we have an age range that, you're right, from 60 all the way into the 80s.
To 80s?
Yes.
My goodness.
Yes, so they're either the grandparents or they're the great-grandparents, a great aunt or uncle, but certainly people who have already retired, if they were working. They were already retired, they're on limited incomes, and they're taking care of toddlers, children, high schoolers, the whole range.
I can't imagine how hard it is to understand school systems and healthcare systems. And what are some of the challenges that you hear from those caregivers?
Well, you hit it right on the money. I mean, if you're caring for minors, it's, I haven't been in school for decades, and how do I navigate the school system, and who am I contacting?
How do you use an iPad?
Yeah, we could get into that. That's right. Here's technology. I used a pencil, right? But school access or school-based resource, the access, that is a big piece of what we do. We're big advocates in making sure that the caregiver can reach the right person at the local school and get information that they need for the child. That's a very large area. I would say the second largest is, believe it or not, healthcare. Now here, imagine you're retired, you're navigating your own Medicare and or private insurance if you're fortunate to have it. And now you have a kid who has healthcare needs, whether it's immunizations for the younger ones or preventative care services. And who do you contact? Because it's not going to be the guy I go to or the woman I go to. It's going to be someone who's a pediatrician. And maybe for decades you haven't had to talk to a pediatrician. So, or understanding how healthcare as a system has changed.
Yes.
And the implications for senior care versus pediatric care. That's a huge area of need, and there's a lot of navigational services and resources needed for that.
So if I'm a grandparent coming in and I'm suddenly taking care of my grandchild, and I come to Atlantic Street, so you have navigational services that'll help me figure out who I'm supposed to go to, what I'm supposed to do, and who to talk to?
We do. It's not as formal and big as we'd like it to be, but within the youth development program, we do operate case management and linkage supports, just like we do in our behavioral health. So I think having partners in the community, other providers, that remains a key leveraging point for us, because we may not be a primary care physician ourselves or primary care provider in traditional healthcare, but we need to know who's out there, or we need to help parents or caregivers who have a doctor but don't know the right questions to ask. Now let's get you to someone who can help you, because these are teenage issues. These are these are not your menopausal or other aging issues. These are issues faced when kids go through their milestones. So we will reach out to other partners and then make sure and we bring them to us too. We'll have special groups, and it may be just about nutritious eating. It may be about dental care. It may be about social emotional supports that they need, but we will reach out and we do that kind of navigation and bring the resources to those caregivers.
The social and emotional piece is really important, right?
Yeah, it's huge.
Can you talk a little bit about that? Because there are issues, right, to help supporting the children, the grandparents, the dyad, but also just the caregivers themselves, I imagine,
that's very
are under
true.
A lot of stress.
Very true. One of our areas of expertise, of course, is youth behavioral health counseling. So we can leverage that, not just through the division itself, but through the best practices. And part of what we do is social emotional. We have some options that are available that aren't necessarily traditional counseling supports, even though many of the kids can enroll and then get assigned a counselor. We go to school. So if a parent or a caregiver says, my kid is at this school, what kind of supports can you give? We'll reach out to the school, and this parent wants support. We have this neat therapeutic gaming that we do.
Oh, tell me about that.
It's called CORE. It's about cooperation and responsiveness, and it's all based on therapeutic, best practices, research-driven. And they curate intentionally really good video games to teach kids cooperative play, stress, self-management, self-regulation. You can do it individually, you can do it in groups. And we do that on site and we do it in the community. So right now we have some summer academy, like our summer camp. And many of the participants aren't just enrolled in Medicaid. They are actually on break. And the grandparents still have their groups, but the kids can be upstairs doing social emotional gaming and learning communication skills and things like that. So again, that wraparound formula works even with kinship supports.
Is it hard for older adults to understand sort of this new frame around caring for emotional, mental health, behavioral health needs in this way? Because that's not what we all grew up with, right?
That's right.
It's like there's been a huge change.
That's right.
both in knowledge and research and
practice even. Yeah. No, you're right on the money there. And that's one way where we support the caregiver, because it's not, a lecturing of sort, like, you're doing something wrong. It's like, oh, it sounds like your grandson or your granddaughter is having a hard time here. We can do this. And then that help that person communicate, or that kid communicate better there. And here's how you can help reinforce it. So even though we're working with the children, we're also working, again, with that caregiver. And there are some challenges. Again, there's generational differences, there's cultural differences that we have to navigate. But by making sure both parties are at the table, so the caregiver and that child, or children in some cases, they're learning together. And that's the beauty of it. They're learning together.
Right.
So they may go play games, but then they come back, and then there's a session, or there's at least a one-on-one with a youth development staff person. We can access, again, our counseling staff. We even have interns who, have less caseload members on their behavioral health caseload, and they lend a hand and help support linking what's learned to what can be practiced. And I understand that the caregivers really appreciate that.
I mean, we continue to learn at all ages, don't we?
We do. And it's non-judgmental. It's meeting the children where they are and meeting those caregivers where they are.
So what are some of the reasons that people choose to provide kinship care?
They vary out of fairness. Some is by choice, in the sense of, I love my grandson, my granddaughter. My own child needs support. In some cases, people have passed away, and now we're in that legal navigation system, and decisions are made that, no, you're staying in my house, and I'm going to raise you. And so certainly by choice. There have been instances where there's court-mandated sort of assignments, and then, again, you're going through the legal, and so guardians, maybe they go officially and become the guardian, but with the court-appointed or mandated, that's even really a key area, because then how do you navigate the legal system as you're now trying to incorporate someone and bring them into the home? It's like family unification with legal, and that's usually another area where we have to, outsource, or either, work with our partners for that. But that's another need as well, and that's some of the things that people say is reasons that they choose to. I want to be the guardian, I want to be the caregiver, so they do it that way as well.
So a lot out of love.
It's out of love.
Out of love.
It's out of love. But the bottom line it's love. Yeah.
And responsibility. And wanting, I presume, and especially, I would imagine, for our communities of color or our different cultural communities, wanting to make sure that connection isn't lost, I would imagine. Oh, no, you're right on the money. I mean, and I grew up in a time where the village was large, as they say, and now that's changed. And we were talking about that it still takes a village, even if it's the village of my aunt, my uncle, and my grandmother, and that is something why that's the reason why these services are really critical. The village may be smaller, but it still takes one. Yeah. Yeah. Are there resources? What other resources are out there? Because it's not the same as if you were fostering a child, or you have suddenly found yourself with your own child, right? Are there, how do systems look at kinship caregivers?
Well, I would say that, of course, there's not enough funding. We're dealing with a couple of pieces that need to be addressed. And one is, again, that aging individual who need their own resources, right, to care for themselves. But being not part of a formal system like foster care, you still need the support to bring resources to the child and to your home. BSK, Best Starts for Kids, has been a wonderful place for family support in many ways, but
and that's a program that's available in the King County area.
King County area, and that's correct.
We wish that it were statewide, but
we really do. I agree with you. Yeah, I would advocate for that. But BSK has been one of the most reliable places to get supports, because even though it's limited because, again, it's countywide, we are able to apply those resources to the areas that we're already not the experts at. So helping us link to others, other providers, other entities in the community, bringing speakers in or supporting grandparents in certain ways that can fund that so that we're able to have some continuity of, resource gathering and service offerings. So that's been one area that's really reliable, and thank you, King County. So, and us taxpayers who make it happen. But there are several other grants, and we have relied on foundation support as well that value and prioritize kind of the non-traditional family support on behalf of kids. I think one of the areas, again, is how do we support the seniors themselves through, other mechanisms that are for them that aren't traditional medical or, and that's kind of the formula that we're trying to work out also.
So you have if I recall, you have a support group just for kinship caregivers, right? To
Yes.
share stories and bond.
Yes, and I believe right now it's on Wednesday nights. So
on Wednesday nights, there you go.
Every week they do get together, and they do a little bit more than that, to be honest with you. That's the space where we can bring folks into Atlantic Street Center, and they feel safe in our locations, and it's like, let's bring the experts here. What do you want to learn about? Need help with schools, like we talked about before, nutrition, and my diet might be different than a growing child's diet. So how do I incorporate healthy eating for a growing child and do it in a way that's economic and, to scale depending on the size of your family? So that's where those resources help us launch really robust weekly events. Over recent years, we had to be creative again using family support dollars and kind of extend it because we also do teens as parents as a program. And in some cases, we have teens who are raising their sibling. So it's not that they're the parent, but they are now in that kinship care sort of realm. Because
it's interesting. I had not thought about that. So you really have kinship caregivers who are sort of really at all ages. So you can actually be a young kinship caregiver or a
18-year-old.
18-year-old.
Yeah. And we have seen that. So so what we do is we try to unify our Tuesday night groups and our Thursday night groups occasionally so that then it's things that they both would benefit from because it's about that child. So, or the children, I should say, the younger children. So,
what advice do you have for somebody who suddenly is finding themselves in a situation where they're going to be a kinship caregiver?
I thought about that very intentionally because there's something we all forget when we're caring for others, and that's about caring for yourself. The first thing is that you're about to make this commitment. Carve room for you in it because, when the oxygen mask drop, you have to put it on so that you can be there. That's probably the number one. Not it's not like you're going to be irresponsible in doing so, but don't forget about you because this will not work. So that's really the first line of advocacy that I would have to anyone is don't forget you're part of the formula.
I think whether you're a kinship caregiver or a family caregiver caring for, say your spouse or your parent or even a neighbor, I mean, that is really something that we don't naturally recall.
No, and I have personal experience in that. Even, we have generations of kids who are parentified children, as the phrase goes, and they're just doing everything for mom because mom is sick, or they're doing everything for dad. They're still caregivers, even if it's not formalized. And I had to learn myself, wait a minute, you're going to run yourself crazy. You're going to be tired. You're not going to make good decisions. I mean, as a young child, teenager, and a young adult, even though I went to college, I was still going back to my home, which is Chicago, and taking care of some matters and helping other family members out. We didn't have technology like we have today, but it doesn't mean that challenge does not exist. So people will forget to take care of themselves, or because that's not why they're doing this. I'm here to take care of Mary or John. And it's like, yeah, but who's taking care of you?
So you yourself have been a family caregiver.
I have. And it was intermittent. I mean, I had to grow up and become an adult, but then later.
Well, would you mind telling us a little bit about your story?
A little bit, I can. As a young child, my mom unfortunately met a mental health crisis. And so I grew up having to be responsible for things, myself and my siblings, even some cousins. The village was a little larger then. But we ended up being responsible for things that usually a 10-year-old isn't responsible for. I mean, going to the grocery store and, just full disclosure, I'm from the inner city of Chicago. I grew up in the, 60s and 70s and, grew up on many public assistance programs. And who's this kid walking down the street with all these groceries or whatever, because this is just a bad spell we're in and I have to do it, or my brother has to do it, or a cousin. Growing up, went to high school, did fine. I went to college, but you still had to come back and forth, and I stayed in the Midwest for that just so I could have proximity. But you still had to take care of yourself. And my education was important. It was important to my family. It was important to my mom. So how do I balance making sure I don't fail that, but yet my grandmother needs help taking care of my mom because she's, needing the support right now.
Yeah.
And it was intermittent, thank God, but, it happened. And then later, as a young adult, then officially went through the legal route, became the, like a healthcare proxy and made medical decisions. But, now I'm an adult. But those are a lot of responsibilities.
It's a lot of responsibility, and it's big decisions when you're caring for your, your ailing parent or
and trying to work. So, but and what's challenging now again is that hasn't gone away. It's not like we have less, or maybe we have few kids who are going into the system. That's what some of the stats tell us. But that doesn't mean the resources are coming to where those kids are, which often is kinship care or caregiving environments by non-traditional parents. So the supports are still needed.
Well, I think we are lucky to have you at the helm of Atlantic Street Center. Really happy to have you here as one of our community leaders. I think that the experience of being a caregiver yourself just helps to reinforce to, our communities about the importance and the value of the work that agencies like yourself do.
Yeah, and I have a great staff. They do the heavy lifting. I have to give them credit. And we have plenty of staff who also have lived experience, so you get out of their way too. And that's one of the things as a leader you have to remember, get out of the way. And I think it's working real well for us at Atlantic Street Center. And again, we have an increase in demand, so we might have to look at some more space so we can do bigger groups and serve more, which is one of our strategic sort of things we're looking at.
The need is growing, and with the aging of the population, I think we are going to need a system that recognizes the caregiving roles that, frankly, at any age, but certainly as we get older and older, that more and more people are having to play.
And families don't look the way they looked.
That's true.
They just don't. They don't look the way they looked maybe in the 60s, 70s, 80s, 10 years ago. And we do need systems that are responsive to that. And we have kids who are growing up. We want them to be autonomous and thriving. And that's what we want. But
and we want at ARP, we want people to be able to age as they want. And that is, even if you have to care, even if you find yourself caring for, your niece, your grandniece, or grandnephew, or your grandchild, that you have the supports and services so that you can live a full and thriving life.
Yeah, and I appreciate you bringing that up because there's a dignity component to this whole formula that people don't talk about. Many of our caregivers are, for example, on limited income. If they retired, they're retired, or maybe they themselves.
That's true. That is one of the big challenges.
And that's, we talk about the social, emotional in a way. It's, the kids for sure learning, but it's also coping. And we have some folks who had wonderful careers and maybe just life happened, and yet they've taken on this responsibility of caring for a minor in their home. How do you do that with dignity? Aging with dignity is critical. And some families might find it hard to reach out and ask for help. Others are glad, and we're there for both, either one. We're there, but we want to do it in a way that also either restores or sustains that sense of dignity, because then the child can see that.
Yeah.
We need children
Yeah.
to have models that no matter how tough life is, we're going to get through it with respect, with dignity. We're going to strive together. We're going to learn together. And folks want to do that. So we have to step up and make sure we can facilitate that as best as we can.
Where can people go to find information and resources about being a kinship caregiver, especially for those folks who aren't in the King County area?
No, that's a great question. At the state level, there's human services as well as children and family services, and there are supports that are available through those departments. So no matter where folks are in Washington State, they should reach out to their local office and find out about kinship care and support services for caregivers.
So I know that for folks who might be watching us or listening to this, if they do go to the Department of Social and Human Services or the Department of Children, Youth, and Families, and you just look up kinship care, the websites should pop up.
It should pop up. Right. And
if technology works for us,
exactly.
it will
and there should be phone numbers and emails where people can then, info at sort of avenues, and then it's.
And we'll have information on our website as well.
Yeah, great.
You and I have talked before, and you know that I really like to talk about and think about moments of joy or things that are the bright spots, and which is what compels us to keep doing what we're doing. That must be something that I hope is part of the kinship experience.
I would say it is. Anytime that you can help, again, we said keeping both sides at the table, so the caregiver, there's this learning together. And it's not an us versus them. And I have heard staff resonate that had a conversation with Mrs. So-and-so, and she was amazed that she and her grandchild could talk about this issue and that issue. That's fantastic. We're at a time where it's stressful. I mean, your usual family dynamic changed. Now you're in this new dynamic, and then there's bonding. I mean, yes, you're my grandmother, but you're a resource to me. So anytime, one of the benefits is the strengthening of the recognition that you are each other's resource in the house. We do hear that. Some of the benefits are as small as just seeing the changes in the child and their performance at school because of the help they got to get the homework help or whatever. Like, you don't know this. This is new science versus, what you may have learned there. No, that's okay. Here's a tutor. Here's this person. Here's that. But I can trust my grandma to make sure I have what I need. Other impacts that are wonderful is just seeing a better communication with school officials, school teachers and counselors, and the support staff, the gym teacher, that it's not, it's my grandmother coming in. No, I want my grandmother to come in because she's going to advocate for me in the school partnerships. That's a big win. That's a big win when and the child has confidence that my grandmother has support or my caregiver has support and can advocate for me in my school setting, at my doctor's office. We talked about aging with dignity. It has got to be a very wonderful moment when you know that you're successful at what your heart tells you to do, no matter what the challenges are, whatever the struggles are. I got my kid to prom. I got my kid to McDonald's. I mean, it could be as simple, because for kids, those are big things, right? Yeah. And when it doesn't go well, you feel like you're failing as a parent. I mean, any parent might feel like they're failing.
Right.
But to say I can do that and my kid's okay and they trust that I'm going to be there for them and I'm an advocate for them so they can do all the kid things they need to do, that's a huge win. When in fact, what's dividing us now are some of the things that are divisive, like the age difference and the culture difference, like you're young people versus not. But if they know that the grandparent has support or the caregiver has support, they know now we're good. I'm going to get what I need.
And I can only imagine that, especially for older adults who find themselves in this position, that there are some moments of humor that come up.
Yes, I can imagine that. Quite a few, actually. Yeah, but think about it this way, too. I mean, imagine you raise your own children. They've graduated. They went through all those milestones, and yet you're kind of there. And I think about some of the events we do. Like, we do celebrate the end of, like, the school year. And we will have, or even our early learning program where these toddlers are 3 and they're graduating from our program with their caps and gowns and their little certificates, and who's by their side? It's grandma, it's my aunt, it's the caregiver. That joy, that's a big takeaway. Like, I'm there for these milestones, and success is so possible despite our challenges.
And I will just say that it won't hurt to have a young person in your home trying to figure out how to make the remote work, how to get that iPad to, like, show full screen, or how do you enter in and order something. So
our favorite is the computer doesn't work. That's a big one. And we've stepped in even with that, or we don't have internet access. So we go to our resources and try to make sure that families have what they need. So, I mean, what kid wants to grow up in a home without internet? I mean, that's almost what home has no internet. There are some.
Yeah.
There are some.
Many things for us to work on.
Yeah.
So I know that you have celebrations for your kinship caregivers and their children. Can you tell us a little bit about those?
I can. I mean, recently we did have a concert, and there's a Grammy-nominated, unfortunately I wasn't there, but a Grammy-nominated performer, a sax player, jazz player, donated and volunteered. I mean, he donated his time and played, and you should have seen, I hear the elation was incredible, because it's like, this is a big star and he's with us in our little program space, and they're sharing that experience with the kids. That was great. One I did experience, and this was a hoot. Was it last year? Yes, it was last year, where we celebrated when King County had, did a proclamation. And then the state did another proclamation. So one of our local state senators came with the King County Collaborative and said, will you host us acknowledging the state's recognition of kinship in May of last year? I think it was last year. But anyway, it was fantastic. It was a 70s themed event. We had the kiddos in another space getting services and doing play and games and fun things. And then all the caregivers, including the dancing 89-year-old woman, we all had our 70s outfits on and glasses. And that wonderful senator, Rebecca Saldana, I'll say her name, she came. She put on a wig, she put on her funky 70s glasses, and we all boogied down.
There you go.
And again, from 60 to 70, you had everyone just in community together celebrating that, at the state level, we're starting to recognize those senior caregivers and other caregiver services. It was a blast. I had a blast. It was so fun.
That sounds like so much fun.
It was fun.
And we love our dances at ARP.
Oh, good.
That's
good.
for sure.
Yeah, it was good stuff, though. But those are just small examples. They do so many wonderful events at Atlantic Street Center, and very creative team. Oh, I should mention that it's not just the staff that create these events, because we're community-led. Those caregivers are the ones saying, no, we want a 70s themed party. We want to hear some music. And they curate many of the elements that we then implement, the ideas for that, and whether it's the music selection or the food that's served, they are part of the implementation team. And that's one of the really big pieces of Atlantic Street Center that I love, even in our other programs as well. But this group, oh my God, it's beautiful to see. It's beautiful to see.
Pila, thanks for spending a few minutes with us today.
It was an honor.
And for talking about these, the wonderful work that you do.
Oh, thank you.
So appreciate it.
I appreciate the time. It's an important issue, and thank you for taking it on.